Hi, my name is Shonette Micco, and I am the Injury Prevention and Outreach Coordinator at Regions Hospital. I oversee all of our injury prevention programming, and one of the largest programs that I oversee is our car seat program. So what I'm going to do here today is review some car seat basics with you as it relates to transporting pediatric patients that are non-critical in the back of your ambulance. So the first thing I'm going to cover is the 4 stages. These are NHTSA 4 stages. The 4 stages are rear facing, so it's the direction in which the car seat's going to be in the vehicle. Rear facing, forward facing, booster seat, and then seatbelt mode. Now, many of you have experienced car seats, whether it's been a part of your own family or as part of your work, but there's always questions. When do we transition from rear facing to forward facing? So I'm going to start off with our rear facing car seats, and I'll kind of go through some of those things with you. This right here is called a rear facing only car seat. Some people call it an infant car seat. It will only go in the vehicle rear facing. One of the ways you can remember that is because typically these are the kind that are carriers that will click onto a base. They don't all have to click onto a base. This can go into the vehicle without a base. So this only goes rear facing. Now I've shown my little doll here as an example with lightweight clothing because we don't want to overbulk our kids in car seats. We want these harness straps to be as close to their body as possible, and then blankets over top for warmth afterwards. You have to keep in mind that car seats are safety devices, and they have been crash tested to meet minimum standards through FMVSS 213. They're also only crash tested in a frontal collision. So the way they are designed and they are intended to perform is in a frontal collision only. Why is that important when we're talking about ambulances? We cannot put car seats sideways in an ambulance. And sometimes that bench seat might be the only thing that you think you can use, but really these car seats are not designed or crash tested for that side impact. So you've got to remember that. For the rear-facing car seat, we always want these harness straps at or below the level of the shoulder, and this chest clip right here is always even with the armpits. All right, so this is our rear-facing only, also known as an infant only. How long do we use this? We use it to the maximum weight and height that the car seat will allow. All car seats will have a sticker on the side that will give you those weight and height ranges. Sometimes there's also an age included. All right, I've got 2 examples of the next type of car seat. It's called a convertible car seat. It's a convertible car seat because it starts off rear facing and then will convert to a forward facing car seat. So the reason why I brought 2 examples here is because they have different weight and height ranges for their rear-facing position. And you would not know that unless you look at the sticker. So you'll want to look at the sticker to see what that rear-facing weight and height range is. So in the rear-facing position, again, we'll have the shoulder straps at or below the level of the shoulder. There's also going to be a recline for that position. So we don't want to exceed the height or weight of the rear facing, and we want to make sure that the shoulder straps are in the right position. This can eventually turn into a forward facing car seat. I'm spending time on this because this is an important car seat for you to know as it relates to being installed on a cot, and we'll get to that in a little bit. All right, so that is our convertible car seat. When do we turn those forward facing? When we max out the rear facing position. We really want to maximize that rear facing position in the vehicle to protect the head, neck, and spine of the child. Again, most crashes are frontal, and we don't want that head and neck to go forward. We want the car seat to catch them in a crash. So when you imagine that crash happening, that child is sort of sinking into the car seat. So that is what we are recommending, and that is what NHTSA recommends and Safe Kids recommends, and as EMS providers, that's what you want to recommend also. It doesn't matter how long their legs get. Does not matter, as long as they fit the height and weight of that rear-facing position. All right, the next stage is a forward-facing car seat. The forward-facing car seat with the 5-point harness, I talk to kids about this being like a race car driver. This would be the next transition after we are in the rear-facing position. We go to a forward-facing position. That could either be with the convertible that's been converted to forward-facing, or it could be this type of car seat that only goes forward-facing, and a lot of those turn into a high back booster. How do you know? Again, you can look at the stickers on the side and it will show you the height and the weight ranges for those positions. This one will not have a sticker for any rear-facing height range or weight range. And then after that, we go to a booster seat. This is a no back booster. They make high back boosters, and we want to keep kids in booster seats until they fit the vehicle seat like an adult. Our seatbelt system is also a safety device, and it's only as good as its fit. And so if kids get out of car seats too soon and they get out of booster seats too soon, they are at risk of seatbelt syndrome, which is a major injury that's lifelong. So we want to keep kids in booster seats as long as possible. The law in Minnesota is that children need to be in a car seat or booster seat until the age of 8 or 4'9", whichever comes first. That's the law. It's not best practice. Best practice is really more around the 4'9". We want to keep them in the back seat and don't move out of the booster until they fit the vehicle seat like an adult. All right, so that kind of covers our basics for car seats. Now, before we go and actually do some work in the ambulance, I'm going to come back to the convertible car seat. And the reason why the convertible car seat is currently the only approved seat to be put on a cot is because there are 2 belt paths. There's the belt path here for when the car seat's rear facing, and there's a belt path up here for when the car seat is forward facing. And that's where the seat belts on the cot will go through to be able to use the seat. The child still needs to fit within the height and weight range for the rear-facing position in the convertible car seat. Last message. If you have children that need to be transported, but they are not the patient, best practice is to never transport them in the back of the ambulance. The ambulance is such an unsafe space for any non-patient. And so we really want to look at community processes or members or other public safety partnerships to make sure those kids can get transported safely and not in the back of an ambulance where their risk of injury would be super high if something were to happen. All right, I think that's all I've got for this part. We're now going to demonstrate putting a convertible car seat on the cot, and I've got my partner here to help me. But before we do that, we need to identify, is this in fact a convertible car seat? Now remember, the convertible car seat can go both rear-facing and forward-facing in the vehicle, which means there are 2 belt paths. We've got a belt path down here for the rear-facing position in the vehicle, and then a forward-facing belt path here. But the stickers will also tell us that we can go in 2 different directions. Now, do we have 2 stickers that tell us that these can go in both directions?
We do have 2 stickers, yes.
Great. And then what's the weight range for rear facing?
Rear facing has a weight range between 2.3 to 18 kilograms or 5 to 40 pounds.
And that's important because when we set this on the cot, it will be facing the back of the vehicle, which is the back of the ambulance. So we need to make sure that the child facing the back of the ambulance is within that 5 to 40 pound weight range. All right, so now we set this on our cot and we bring the back of the cot up to kind of meet the contour of this reclined car seat. We're going to use 2 sets of straps to strap this in. Any straps not being loose should be secured so they don't become a flying object. So if you want to hand me that part.
Absolutely.
And I'm giving you the hard job.
Okay.
All right, and then pull the strap tight. And I'm pressing down to kind of help make this nice and secure. Perfect. All right, we'll do it now with the next strap that's going to go through this belt path right here. It's good to have a lot of length to work with so that you can get this through. And if you want to come in front of the buckle,
Absolutely.
that way it won't interfere with the 5-point harness on the child. Okay, got it. We're buckled. Pull it tight. Great, perfect. Now, as you can see, this is in nice and secure, and your child can be placed in the car seat. There are circumstances when there might be a car crash and a child is already in a car seat. It doesn't mean that that car seat didn't sustain any kind of crash damage, but if it's intact, it might be the best way to keep that child secured by using the car seat as sort of that splinting piece of equipment, and then putting the car seat on the cot and buckling it in while the child is on the cot. All right, I think that's it for this one. So there's a very good chance that you do not have a convertible car seat available to you, yet you have a pediatric patient that needs to go on a cot. First, be prepared that there isn't a car seat available, and have whatever device that your service uses to secure pediatric patients on the cot ready and available. So we have our PediMate already set up so that when we come to our patient, we have this ready to go. If there were a convertible car seat that we could use, certainly we could take this off and use that seat. But in this case, we don't. So we're gonna demonstrate our PediMate Plus, and there is a weight range, 10 pounds to 100 pounds, or 4.5 kilograms to 45.4 kilograms. So you've gotta follow that too. All right, so we're gonna place our child. Shoulder straps go over the shoulders. We've started out with all of the straps fully extended because we did not really know the size of our child. So I'm going to pull through to kind of get the shoulder straps snug. And then after we do that, we can tighten at the hips. There's also the ability to bring this crotch strap down. And there we go. Make sure all 4 prongs are showing and that you've got these over the shoulders, and any other straps not being used are secured so they don't become a flying object. Okay, so here we are in the back of an ambulance, and the industry is really moving towards not only protecting the patient, but protecting the provider or anyone that's traveling in the back of an ambulance. So just as a reminder, keep all of your equipment stored and locked, bags stored and locked, always buckled in while you're back here. So if something were to happen, things aren't the flying object that hurt you or the patient, and you aren't the flying object that hurts you or the patient. So now that we have moved to this sort of area of safety, of really protecting the occupants the best way we can, the reminder is, if you aren't the patient, travel in a different way. So best practice is the providers and the patient should be back here. All right, so one of the options we have is the integrated car seat in the captain's chair. We have secured the 5-point harness behind the seat so that doesn't become a flying object and hit a child. When we pull this open, the straps for the 5-point harness should be fully extended. So make sure that that's ready to go, because again, we don't know what size child we're going to be working with. This is an integrated car seat that is approved for use as a car seat. So there are instructions here that will give you the weight range and the height range that can be used. So follow that as well. It's also intended to be used forward facing. So once we put the child into this captain's seat, into the integrated car seat, we will rotate the seat around to face the front of the vehicle. So the shoulder straps will come over the child. Again, we have that chest clip that will eventually be even with the armpits. The buckle. And in car seats that we put in our vehicles, we can typically tighten the straps by pulling on something right here. But for this one, we tighten at the shoulder. So as you can see, that chest clip is moving up as we're tightening. So it might be that we have to start off with that a little bit lower. So as we tighten, we're not hitting the child's chin. We can always adjust where that chest clip is at the end. Now, before we're done, this safeguard needs to come down, be pulled right down and secured right at the child's shoulder level. And then we rotate the seat. Oh, wait a second. And then our outtake is, and then you take the strap off of the child's head. And then we rotate the seat. Oh, you poor thing, I'm sorry.